Good evening. I'm Psychiatrist Jay Fawver, live from Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 27th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, give me a call here in the Fort Wayne area by dialing 969-2720, or if you're calling any place coast to coast, you may dial 866-969-2720. Now on a fairly regular basis, I am broadcasting live from our spectacular PBS Fort Wayne studios every Monday night. And if you have any questions concerning mental health issues that I can answer on the air, you may write me via the internet at Matters of the Mind, all one word, at WFWA.org. That's Matters of the Mind at WFWA.org. And I'll start tonight's program with a couple emails I just recently received. They are somewhat related. The first one reads, Dear Dr. Fawver, my 42-year-old son is bipolar. He takes medication and has regular psychiatric visits. What long-term effects from the medications are expected? His grandmother was bipolar and eventually had dementia, but she also had quite a few ECTs. Bipolar disorder is basically where somebody will have unnatural manic highs, and those highs can be manifested by feeling on top of the world or irritable, and sometimes people will notice having one or the other type of mood or both, but a lot of times when people are on those highs, they will not need to sleep, and they'll go for days, sometimes weeks, with not needing to sleep. And you might think, well, gee, that sounds great. Well, the problem is you get into trouble there because with lack of sleep, you start to diminish the ability of the judgment part of the brain to think, so you start to have more impulsivity, and you do things and say things you ordinarily wouldn't do or say, and it gets you into trouble. People with bipolar disorder are quite more likely to lose their jobs and have more difficulty in marital relationships. So there's consequences with manic highs, and you can have the depressive lows where you have the depressive symptoms themselves and you don't want to get out of bed. You're too sad to be able to leave the house. You're more socially withdrawn. So it's a condition of having manic highs and depressive lows. So with bipolar disorder, the condition itself is somewhat related to epilepsy. With epilepsy, there's these imbalances of glutamate and GABA. Glutamate's the excitatory neurotransmitter of the brain. GABA is the brakes on the brain. So you have this imbalance of glutamate and GABA. And that's what happens with seizures. That's what happens with bipolar disorder. So untreated bipolar disorder, where you have manic highs, especially as well as depressive lows, when you have the highs and lows, you can have a damaging effect on the brain. What damaging effect might that be? Well, there's roughly 20,000 to 50,000 branches on each individual neuron in the brain. The brain's loaded with all these little neurons. You should have between 20,000 to 50,000 branches on each neuron. And when you have manic highs and depressive lows, it has a neurotoxic effect, and it doesn't kill the neurons, but it makes them shrivel up. So you'll have kind of like a neuron that looks like a shriveled up bush, and that's what happens when you have highs and lows that are unnatural. It's not the medications that are causing the damage in that regard. It's related to the highs and lows and the mood disturbances themselves, because similar to seizures, which can be toxic to the brain, manic highs and depressive lows are also toxic to the brain. The medications are trying to correct those imbalances, and many of the medications we're using nowadays actually show evidence that there's improvement in these branching in the brain with proper treatment. Now, what medication side effects can you have? Some medications are more toxic on the liver. I'll give you an example. Depakote. Depakote can increase liver enzymes. For some people, it's really related to the dosage, so we have to watch the dosage and keep the dosage as low as possible. The Depakote, also known as divalproex, can give you liver problems. Lithium is a very safe medication to take, particularly if you use the extended release version and dose it all at bedtime. It's easier on the kidneys, but with lithium, we have to make sure that the kidney functions are adequate and that the thyroid functioning stays in a reasonable range when somebody takes lithium, because lithium is a salt. It does go to the thyroid, and it can be somewhat toxic on the thyroid. That can be corrected with thyroid hormone if need be, so there's ways to get around that. But many people have the misperception that the medications are toxic on the brain. It's more of the effect of the underlying condition of bipolar disorder itself, if not treated, being toxic on the brain. Thanks for your email. Let's go to our next email because it's somewhat related. Our next email reads, Dear Dr. Fawver, my husband has been diagnosed with bipolar disorder in the past 7 years. His mother at first refused to believe it, but is slowly realizing the truth. What resources can we use to help her understand his illness? She just doesn't understand. You're referring to the mother. The best resource I'd recommend for any family member of a loved one with a mental illness would be the National Alliance on Mental Illness, NAMI, the National Alliance on Mental Illness. NAMI's been around, oh my goodness, for decades now, and it's a very good support organization for family members who have loved one with mental illness. What I like about NAMI with the resources is they're not politically biased. Many associations where I'm reading on the websites are very politically charged right now, and I wouldn't recommend going to those because you have to keep digging and digging to find the information you really need to get past the politics that they're trying to convey. NAMI is not doing that. NAMI gives you very good information on speaking to family members with various mental illnesses, especially bipolar disorder. They give you resources giving you easy to understand complexities of bipolar disorder itself, how it's treated, why it occurs, and what are the genetics and the likelihood of another family member experiencing it, and what you can do as a family member. Now, if you go to the website, you can also find that there may be a NAMI group that meets on a periodic basis in your area. So if you can attend a NAMI group, that's free of charge. Is something that is across a lot of communities in the United States, but that would be the best resource that I'd recommend for a loved one with bipolar disorder. Thanks for your email. Let's go to our first caller. Hello, Olivia. Welcome to Matters of the Mind. Olivia, you want to know what are spring bipolar manic episodes? When somebody has what's called seasonal affective disorder, affective disorders, where people will have mood disturbances based on the season. Now, about 4 out of 5 people that have this condition will notice they get more depressed in the wintertime and more hyped up in the spring. And that's what you're describing. Some people will get more hyped up in the winter and more depressed in the spring. That's quite rare. Only about 1 out of 5 people with seasonal affective disorder will have that. But most people get more depressed in the winter, usually from October until about April. Around April till July or August, they can get more manic. So it's where people will distinctively have manic episodes in the spring and early summer. And while these manic episodes, how are these manic episodes characterized? Decreased need for sleep, impulsivity, racing thoughts, fast rate of speech, and generally doing things and saying things they ordinarily wouldn't do or say. And the problem they'll often experience is periodically they will crash into lows. It's not unlike somebody who's using cocaine. If somebody uses cocaine, they'll feel really hyped up and energized for a while, but then they just crash. Your brain can only function on that much high activity for a while. So bipolar mania is where somebody's sky high, and it's thought that when people have seasonal affective disorder, they're more sensitive to the sunlight. So in the wintertime, if they have winter depression, typically they will get more depressed in the wintertime because there's less sunlight. And then in the spring, they're more sensitive to that sunlight, and they'll get more hyped up and more energized during that time. It is treated sometimes with mood stabilizing medication. I'm not going to recommend that people stay out of the sun in the springtime if they have spring manic activity, but that is a contributor. I'm going to recommend somebody get on a mood stabilizer if they're having spring manic activity. And what's it mean? I mean, when you're manic in the spring, shouldn't we all feel more energized and more enthusiastic in the springtime and summer? We should, because, yeah, it's nicer weather. We're typically more physically active. We're more socially active, at least here in Indiana in the spring and summer. So we tend to be around people more, and that's a good thing. So you don't want to mitigate that in any manner, but if somebody's having manic episodes to a problematic degree where they're getting in trouble with spending and doing things and saying things they ordinarily shouldn't say, that's where they will benefit from a bit of a mood stabilizer. And a mood stabilizer is basically a cruise control on the mood to keep them from going too high, keep them from going too low, and just allowing them to have the normal fluctuations, which are called vicissitudes of the mood itself. So you should feel happy when you have happy circumstances occurring. You should feel sad when disappointing circumstances are occurring. So you should have these normal fluctuations of mood that are there. That's perfectly fine. It's when they're unnaturally high, unnaturally low, and they're getting you into trouble. That's where they're problematic. Thanks for your call. Let's go to our next caller. Hello, Paul. Welcome to Matters of the Mind. Paul, you want to know, can high caffeine levels cause panic or anxiety attacks? As I take a sip of my caffeine. High caffeine levels where they're too high, you bet. They can cause you to have an increase in dopamine and norepinephrine, and by doing so, with some people, if you go a little bit over the top in terms of where you should be getting the norepinephrine and dopamine, that will make you kind of shaky and hyper and irritable. Sometimes it'll give people headaches while they're using the caffeine. Sometimes when they're withdrawing, that can be the factor. The main purpose of caffeine for people if they use it at appropriate amounts, under 400 milligrams a day typically, would be that it allows your brain to be awakened. As you go through the day, your brain will give off these exhaust fumes called adenosine. When adenosine is released more and more and more, it goes to adenosine receptors and it makes you slowly more tired. What caffeine will do is go to the adenosine receptors and fool the adenosine receptors, thinking they're adenosine, and basically blocking the receptors so that you feel more awake and more alert. That's okay. That's the whole purpose of an appropriate use of caffeine. When you get too much caffeine, it goes beyond just blocking the adenosine receptors and it starts to affect norepinephrine and dopamine, and in doing so, it can give you a faster heart rate, tremors, irritability, and anxiety. So that's where you're gonna go over the top, back off on your caffeine intake if you notice that's happening. Thanks for your call. Let's go to our next caller. Hello, Tim. Welcome to Matters of the Mind. Tim, you want to know, what is antisocial personality disorder and what can you do to help your teen be more social? I think you're talking about two entirely different phenomena there, Tim, because antisocial personality disorder is where, as the name implies, you are doing things that are directly opposed to societal norms and legal norms. In other words, people with antisocial personality disorder don't care what the consequences of their behaviors are on other people. They're going to do it anyway. So they will lie, cheat, steal, and they will very much violate the boundaries of other people and the social norms that we would expect. And they get involved in a lot of illegal activities. That's antisocial personality disorder. They don't see a problem with it. They get in trouble. They get arrested. And it's very difficult to treat because they don't often see it to be a problem. You're referring to your teen being more social. That's not antisocial. Your teen might have some social anxiety. Your adolescence, my goodness, it's normal to have some anxiety during adolescence, not only for academics and getting through life, but also you're trying to learn social nuances and you're trying to mirror behaviors of others to try to be able to connect. As we all go through our adolescence, our front part of our brain is growing and growing and growing, and it doesn't fully grow until you're 24 years old. So as the front part of the brain is growing, you're more comfortable with stresses and situations that might involve socialization and so forth because you have practice doing it. So the first thing you can do to help your teen become more sociable is to try to get your teen out and about more, around more people, to be able to practice those kind of social activities, and also mirroring your behavior. So you can go with your teen to try to do simple things and teach your teen how to shake hands, look at people in the eyes, greet them by name, and interact with them in an appropriate way. And it's a practice over the course of time. And the idea will be that your teen will be more sociable and be able to feel more comfortable in social environments. Where I'm always concerned is where I see adolescents at 13, 14 years of age. They're anxious about life. They're anxious about their academics. They're anxious about their friends and their social situations. They're anxious about a lot of different things. Well, you're supposed to be anxious when you're an adolescent, for one thing, but if you start using marijuana as an adolescent, you don't care. And you use marijuana to socialize, and it used to be alcohol, but now it's more marijuana. Adolescents and young adults aren't using as much alcohol now as they did 20, 30 years ago. I'm seeing a lot of marijuana use, but the problem is marijuana use is more toxic to an adolescent's brain, in my opinion, than alcohol, because marijuana use will slow the development of that brain, and they'll really lack emotional maturity. They don't learn how to naturally feel comfortable in the presence of others. So if somebody starts using marijuana as an adolescent to get through the social anxiety that they should normally endure and be able to overcome, they will notice that when they get in their 20s, their 30s, their 40s even, they can still feel very, very uncomfortable in social situations because they didn't learn how to socialize without the use of the marijuana. So I'm always warning people about using medicinal means of helping them with socialization in that manner, Tim. Tim, thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, can you explain the uses, doses, and drug interactions with the supplements ashwagandha, berberine, and NAC, N-acetylcysteine? Well, okay, let's give that a try. I get these questions all the time as a psychiatrist because I have to be aware of drug interactions, but I'll give the disclaimer that I often give many people: always talk to your primary care clinician before starting a supplement to make sure it's in your best interest medically overall. But I have to be aware of these interactions and the uses of these supplements because they can affect the medications I'm prescribing. So let's start with ashwagandha. Ashwagandha is basically available for the purpose of helping you put up with stuff better. It helps with stress tolerance for a lot of people. It affects people differently. And I think a reason it does is because it will increase the availability of your thyroid hormone. So if you're high normal on thyroid already, ashwagandha can actually increase the activity of your thyroid and make you anxious and hyped up and give you a fast heart rate. It's probably because the indirect effect on its thyroid itself. Ashwagandha itself outside of thyroid doesn't seem to interact with other medications that we're using. But ashwagandha's dose, you had asked about the dose. It depends on what formulation you use, but a lot of formulations, it's around 300 milligrams twice a day. But it's something that is used for the purpose of helping some people with stress tolerance. But what I like about ashwagandha for a lot of people is that it does possibly decrease cortisol levels. Pretty good studies out there showing that it might decrease cortisol levels. So when you're under stress and you're having a hard time putting up with stuff, ashwagandha might be able to decrease cortisol levels. And it's thought that increased cortisol can be a precursor to diabetes because higher cortisol increases blood sugar. So if you're under stress, stress is increasing cortisol, ashwagandha might suppress that. So that's the use and benefits and the doses of ashwagandha. You had asked about berberine. Berberine is something that's been discussed for about the past 5 or 6 years now, quite a bit. It's an interesting herb in itself. It's a yellow herb in the capsule, but it's something that's typically dosed 500 milligrams twice a day with food because it makes you feel full. It decreases the stomach motility, so it decreases the emptying of the stomach. But it has a lot of discussions in the past few years because it has some similarities to the very popular GLP-1 agonists, the glucagon-like peptide type 1 agonists like Ozempic that you might have heard about, semaglutide. But it has some overlapping effects with that in the sense that it's suppressing the release of glucagon in the pancreas, and glucagon increases blood sugars. It increases insulin and increases insulin sensitivity, not unlike metformin might do. So when we talk about a supplement like berberine, you have to be careful about using it with metformin or any other medications that are decreasing blood sugars because it might decrease blood sugar excessively. So if you're using berberine, you might want to keep an eye on your blood sugar with a finger stick on a regular basis to make sure your blood sugars aren't going too low. If you feel weird or awful with berberine, it would be due to your blood sugar decreasing too much, or maybe your blood pressure decreasing too much, because it can also decrease your blood sugar or blood pressure by expanding the blood vessels and causing vasodilation. So that can be a factor as well. It can decrease your blood sugar and decrease your blood pressure, and its potential use is also the possibility of partially decreasing the lipids in your system and decreasing cardiovascular risk. Not that it necessarily would replace statins for everybody, but that's something you have to be careful about. Berberine is something that will interact with pretty much anything. It can basically increase blood levels of many, many different medications. How much? Is it clinically significant? That's always a judgment call, but it can mildly inhibit the breakdown of medications in all sorts of different metabolic pathways in the liver. So if you're on various medications and you take berberine, the blood levels of the other medications might increase a bit, and you might say, well, gee, I feel lousy in this way or this way. It could not be, it might not be the berberine, it could be the increase in blood levels of the other medications. And you mentioned NAC, N-acetylcysteine. N-acetylcysteine usual dosage is 600 milligrams twice a day. It's a byproduct of cysteine, which is an essential amino acid. Glutathione is an antioxidant that produces, so NAC produces glutathione. That's a very strong antioxidant. So it basically cleans up the junk in the body, and it's thought to stabilize glutamate. So it's thought that when people have schizophrenia, bipolar disorder, which we discussed earlier, that one of the mechanisms for their having that particular condition will be they have excessive glutamate transmission. Glutamate's excitatory, and it doesn't get cleaned up adequately in the brain. So if you use NAC, that can help clean up the excessive glutamate in the brain. It also, like ashwagandha, can help you with putting up with stuff better. And it's thought to help with respiratory conditions. If people have trouble breathing, they can use NAC. We're using NAC 600 milligrams twice a day, typically for somebody with obsessive compulsive disorder, where they have these ongoing obsessions. They just keep thinking about stuff and thinking about stuff, and they can't get them off their minds. And then they will have compulsions where they do things unnaturally over and over again. So NAC has a lot of different uses. Where wouldn't you use NAC if you have a sulfa allergy? NAC is related chemically to sulfa, so if you have a sulfa allergy, you should not use NAC. You can get a rash from it if you do. So that's the kind of overview with ashwagandha, berberine, and NAC. I hope that helped out. Let's go to our next caller. Hello, Matthew. Welcome to Matters of the Mind.
Hey.
Hey, Matthew. Good to hear from you.
Yeah. I was talking about depression. I have OCD, but I've called before. I'm taking medicines, venlafaxine, and I wanted to take Luvox. I remember you recommended that a long time ago, and my doctor won't let me take it, or she recommends I don't. I want to take venlafaxine and Luvox. It doesn't matter. The point is, none of these medicines have ever worked. I mean, I'm depressed. My life is over. I mean, I have a place to live. I have food. I have medicine, but I see nothing's going to change. And I'm alone, and I'm depressed, and I think about suicide quite often. I would never do that, but I do think about it. I'm just morbidly depressed. And I think there's no reason for me to be alive.
Yeah, Matthew, you have a common symptom and people will often experience with depression where they're not wanting to kill themselves, and that's what you're describing, right? You're not wanting to kill yourself, you just don't see any purpose in life at this point?
Yes.
Yeah. So the first thing I'd recommend for you, Matthew, is make sure that you do have a safe environment in the event that you ever do get to the point where you actually think about suicide or carrying through. You can always contact a local mental health center, contact your therapist or your doctor if you're in that position. But do you have a therapist at this point, Matthew?
No, I've tried that and it was meaningless. They just told me to go home and don't have OCD.
Yeah, you might want to try somebody different, and sometimes people will recommend a case manager in this kind of situation. A case manager just helps you with day-to-day functioning. You have a place to live, yeah, we get that, but you also need to have some kind of meaningful activities on a day-to-day basis. For instance, in the Fort Wayne area, we have an organization called the Fort Wayne Clubhouse, also known as the Carriage House, and it can be a very nice venue for somebody on a regular basis to attend because it gives them a sense of belonging. It gives them a sense of meaningful activities, gets them around other people that might have various conditions. So you can always contact your clinician about other possibilities. Venlafaxine is Effexor, and yeah, that helps with some people, but keep in mind, Matthew, we have, my goodness, 29 different medications we can use now for depression. So if one doesn't work, often we'll go to a different mechanism of action. Luvox, fluvoxamine is the chemical name of that. Sure, that's been around for a long time. Very good for OCD, but it does have some drug interactions where it can increase blood levels of various other medications, and that sometimes will be a reason why it's not used. But I would suggest to you, Matthew, don't give up at this point. Try to contact a mental health clinician, somebody maybe you've not seen before. Ask your clinician about other possibilities in terms of who you could see for talk therapy. Group therapy can be helpful. And like I said, if you're in the Fort Wayne area, the Fort Wayne Carriage House or Clubhouse would be a good option for you. And to get involved with that, you'd contact a local organization like Park Center, which we have here in the Fort Wayne area. But that would be a good possibility for you, Matthew. But like I said, don't give up at this point. The field of psychiatry is booming right now with possibilities for people with depression. We have all sorts of treatments now that we didn't have as recently as 5 years ago. So there's a lot of reasons to have a lot of hope at this point. Matthew, thanks for your call. Let's go to our next caller. Hello, Don. Welcome to Matters of the Mind.
This is Don.
Hello, Don.
No, I'm schizophrenic. I've been diagnosed with schizophrenia for 45 some years. And is there a cure for it? I've been taking medicine and Vega injections most recently. And is there a natural cure for it? Because I feel I don't need the medicine anymore since the first of the year.
Wow. Don, does that mean that you're feeling pretty normal? You can do the things you want to do. You can think clearly. You're maybe not hearing voices. Are you saying you're doing pretty well at this point?
Yes, and I've been monitored by Park Center.
That's fantastic. Well, Don,
I'm still under care.
yeah,
But I
schizophrenia.
feel I've been cured. I don't need the medicine.
Well, the good news is you're doing well, Don. That's fantastic. However, you're doing so well right now, quite frankly, because of the medication. It's kind of like somebody with epilepsy, Don. I used that analogy earlier, but when somebody has epilepsy and they're free of seizures, that's wonderful. But if they had seizures previously again and again and again, and they are free of seizures now, they might need to stay on the anti-seizure medication for the time being. Schizophrenia is a long-term condition. Okay, that's the bad side of it. I mean, you have to take a medication ongoing, but you're taking Invega. It's easy to use Invega because you just go in for your injections and that's it. Now, what sometimes will happen, they might lower the dosage a little bit on the Invega as you're doing well, but you might be doing so well because you're at the right dosage. So I think that's fantastic, Don, that you're actually doing so well. You wonder, gee, is this medication doing anything for me? It probably is at this point, such that you are doing well. The risk of your going off the medication entirely, Don, would be you could have a relapse and have another episode of psychosis. Don, thanks for your call. Unfortunately, I'm out of time for this evening. If you have any questions concerning mental health issues, you may write me via the internet at mattersofthemind@wfwa.org, and I see if I can get to your question on the air. I'm Psychiatrist Jay Fawver, and you've been watching Matters of the Mind on PBS Fort Wayne, now available on YouTube. Thanks for watching. God willing and PBS willing, we'll be back again next week. Good night.
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronMCH.com.